Next, we're going to move on to the concurrent session 1, Smart Innovation for Life and Health Sciences. First of all, we would like to invite Mr. H.L. Hui, Chief Systems Manager of Hospital Authority, who will talk about Smart Hospital. Please welcome Mr. Hui.
Can you hear me? Right, it's really a surprise. I just entered the venue. I don't know the venue is the event is overrunning maybe. Right, so I tried to be quick. Let me set my timer. Right, I have 15 minutes. So today I'm here to update you about the progress of Smart Hospital strategy being implemented in Hospital Authority. So is that the, right. All right, I think first thing first, the top-down support is very important for Smart Hospital strategy implementation at Hospital Authority, and we have it from our chairman and also from our CEO. I think they keep telling people why we need it and how we're going to use it to improve the patient experience. And so basically, the target of Hospital Authority's Smart Hospital strategy is to improve the patient experience and also improve the efficiency of the hospital service. So this is the Smart Hospital blueprint. So there are 5 areas. The first is the care part, which is the core competence of Hospital Authority. So that is about the clinical and business process around patient service delivery. And of course, we also have hospital support, which is more about non-clinical. And then the hospital management to the right-hand side is about the use of data to improve the manageability of services, to improve the allocation of resources, for example. Now at the bottom, of course, we need the settings to be smart, okay? The infrastructures to be smart, the network to be smart, right? And of course, we have probably one of the most smart people in Hong Kong, right? We have our staff, and we have to make sure the staff will be able to enjoy some of the benefits from the smart technology. So our approach is once we devise and develop smart solutions, we will have them pilot in one of the 3 pilot hospitals. So namely Queen Elizabeth, Tin Shui Wai, or Zhang Quan O, right? So these are the 3 pilot hospitals we have. So we sort of pilot our solutions there, and once they are successful, then the other hospital can just budget and implement those solutions in their hospital, right? Through using our instruction sheet. So that is what we call the co-delivery approach. So we do not need to centralize the rollout, and that will be much faster. And before I talk about Smart Hospital, there is one thing that I must point out is the unique asset that we have in Hospital Authority for many of you, right? Especially when you are one of the members of public of Hong Kong. And over the years, we built this electronic medical records, which we call CMS, the Clinical Management System, that supports basically the entire operations of all the 43 hospitals and 122 clinics in Hong Kong, right? So these are systems that we developed over this 30 years. Okay, they are well integrated and generate entirely integrated data for all the people in Hong Kong. So again, there is one difference between hospital authorities and other hospital is the size, right? We have, like I said, 43 hospital and 122 clinics, okay, with now 30,000 beds. In terms of floor space, we have 3 million square meters of floor space, right? Support the entire Hong Kong's public health care. So size is very important in the consideration of any system development in the hospital authority. And as a result, we receive very good international recognitions on our IT status. And late last year, we went through a month-long assessment process with HIMSS. HIMSS is an international certification organization. And they were amazed by the fact that all the 43 hospitals, 122 clinics around the whole territories are using the same system, okay? So after assessment, very careful assessment, they award in one go a stage 6, certifications to all the 43 hospitals in Hong Kong. Now that is a very unique achievement, right? Because elsewhere, it normally will be a cluster of a few hospitals, right, or a single hospital. But in Hong Kong, it is a one go of certifications for all the hospitals. And well, next year, for some of the newer hospitals, we will go for the stage 7, which is the highest level of quality in terms of HIMSS certification. Now, HA-Go, I will skip this slide because we will talk more about this, but this is a very important platform to support the smart hospital in Hong Kong, right? So this is basically a mobile app that all of you can install, okay? If you haven't installed, then install it now, all right? Okay, at the end, we will have that QR code, okay? This HA-Go is developed for you, right? And over the last year, for example, you can see, again, the volume of transactions through HA-Go. So you can do registration, you can take attendance, you can make payment, right? Things like that, right? But it's all on your fingertips. Right now, we have around 1.2 million plus very active members, and we are looking forward to grow, the base of users. And again, this is the potential of HA-Go. Okay, together with the new HA strategy, we are going to change the care models for the population. So the care is not just inside the hospital and clinics. The care will also extend outside the hospital and clinics, at home, and also in the community. Okay, and together with some of these from the vendors and the commercial. So you can see the smart hospital, HA-Go, and also the CMS are 3 cornerstones to support a more smart and a different transformed care model, okay? And again, it's an ecosystem, okay? These new care models must be co-working with the citizens, with the public, and also with the vendors to make it successful. Now, next, I'm going to go through some of the key products with you under the smart hospital. And first thing first, again, medical service. Maybe some of you are medical doctors or pharmacists. You all know that the clinical services are very complex, especially in hospital authority, because we never select, right? Okay, anybody who come to the public hospital, we need to treat them, okay? So normally the cases are very complex, right? The scenarios are very complex. The settings are very complex. The facilities, we have different facilities to serve the patient in different conditions. And at the back, at the right-hand side, you will see, as you all know, we have different specialists supporting this service, right? They are all highly educated, okay? They have their own say. So again, the whole thing in medical health care, as all of you know, is very complex. And of course, the care is, as I said, the most important part or piece in the whole jigsaw. So In the care settings, there are different places that we have to have smart solutions, but we do not have time to go through all of them. So I just list some of this smart solution here on this slide, and if you are interested, we can further discuss offline, okay? So they cover emergency room, they cover OT, they cover pharmacy, nursing, and allied health. But visually, I want to go through a little bit more on the ward side, okay? So there are some pictures here that I think perhaps you can understand more through pictures. One thing, first, because I know a lot of friends here are from medical technology background, okay? On that side, it is not really our focus, because at the actual clinical service point, they will use a lot of medical technology. Okay, like this morning, the lady talked about, the poop, how you can tell, your disease from the poop. We are happy to have that technology. Okay, but what we need is IT. It's all about how to gather this information to make sense under an integrated record, right? So we have a very safe system using packing technology, machine technology to do the inpatient medication order entry. Okay, of course, a lot of barcode as well. Okay, for the electronic vitals, basically, that is the physiological mon, but we do 6 types of interfaces so that all these vitals can be integrated into our CMS records. We have wired, we have Bluetooth, we have Wi-Fi, we have cloud, we have QR, and now we are doing the OCR type of interface. That is the eVitals. The smart panel, you see a lot of this everywhere, okay? They look like a dashboard, but this one is also an iBeacon, right? So when you are walking close to the dashboard, it actually selects the patients for the doctors. And that works very well with our 1D1P program, because all the doctors now have this iPad in their pocket, so when they are next to the patient, so they can start taking care of the patient in no time. And then down there, I hope that you can see it, but with this iPad of the doctor, they can do a lot of things like signing consent form, okay, so making entire things quite paperless. The nurses, they have their own share iPad. They can also do a lot of specimen collection and document scanning. We're also using some technologies like NIDA to do for prevention. On the clinic side, we also devised a number of smart solutions like the queue management. You have that queue management. I think that is the number one thing you need. And the number two thing, or perhaps that is number one, is the Wi-Fi and kiosks, and also the paperless clinic. You can see a lot of clinics now are much cleaner, okay, because we are trying to running it in a paperless mode. The doctors, they don't need to print the lab result out to screen. They use their iPad, again, from their pocket. And then, again, we have eVitals there. Most importantly, the HA Go. Again, if you haven't installed your HA Go, install it now, okay? So that is that is a tool that helps you save your time in the clinic. Telehealth, again, this few months, boom, very important. By early October, we have done 84,000 teleconsultation through the HA Go. And in fact, in the elderly home, we have been using the iPad again to do the remote consultation. And we have this tele-rehabilitation for a year now. And on HA Go, again, you can interface with your health kit device, and then you can upload your result to the CMS when you are in the consultation room. Hospital Command Center. Okay, we have a lot of this data, and we are piloting this Hospital Command Center in Queen Elizabeth and also a few other hospitals. And basically, it's a room with a lot of this dashboard, centralizing the data and also analyzing the data to recommend some actions for the hospital command center team to reallocate the resources and also to highlight some fast deteriorating patients. Okay, and thanks to the medical technologists here, they generate a lot of information that can tell whether some patients are deteriorating fast, okay, things like that. And also real-time location tracking is something that we are working on, and the first asset that we are tracking is the stretcher. Okay, it's just like the supermarket's shopping cart. And so that is something that we are piloting in the 3 hospital. And then we are also doing the specimen tracking, also through this RTLS technology, okay? Oh, I'm running out of time. I only have a few slides more, okay? So Internet of Things, we do this now more in the lab, okay? We have tried wearables, but for some practical reasons, it's still not really in operations at the front line. But in the lab, we have done quite a number of them. And yeah, there are other part of the IoT that we have to work on to support a more smart hospital. But for example, API, we have had already that set up. Oh, robots. Robots, just like, you know, a lot of these malls, we have all sorts of robots walking around, okay? But we are eyeing on the therapeutic robot in the middle, okay? Right now we have one robot that can do telehealth for the patients, but we are looking at, you know, robots that can help comforting, you know, elderly patients, things like that. So that is what we are doing, and we are heading for some more invasive use of robot. So like, this is a slide summarizing what we are doing, right? Over the 30 years, we've been digitizing all the data into the CMS, EMR, and over the last 10 years, we are trying to make the process more automated. Okay, we have you know, a lot of paperless initiatives. Now we come to the next 5 years, which is the digital transformation inside hospital authority through the new HA strategy 22 to 27, which all of you can download from the HA website. So, so finally, this is the QR code for the HA Go. If you have never heard of HA Go, or you have not installed HA Go, this is the time that you should do it, right? So thank you very much.
Thank you very much, Mr. Hui, and I have just installed my HA Go. Thank you very much.
Yeah, thanks, Mr. All right.
Next, we would like to welcome on stage Dr. Joshua Ho, Lead Scientist of Laboratory of Data Discovery for Health Limited, to share with us digital healthcare innovation at Data Discovery for Health. Please welcome Dr. Ho.
Good morning, everyone. Thank you very much for the kind invitation. So today I'm going to talk about the digital health innovation technology that we have been putting together at the Laboratory for Data Discovery for Health, D2-4H, which is one of the funded Hong Kong Center through the Artificial Intelligence and Robotic AIR initiative. So my name is Joshua Ho, and I'm a lead scientist at D2-4H, and I also have the role of an associate professor at the University of Hong Kong Faculty of Medicine. So this is a center started in 2020 through the Hong Kong initiative. So our founding managing director was Professor Gabriel Leung, and in collaboration with experienced data science and healthcare professors at the Faculty of Medicine at the University of Hong Kong, we put together a very strong team with expertise in global health and precision medicine, all through the use of big data and artificial intelligence. So I think it's best to let our
呢位大數據深色實驗室 D2-4H 有兩大目標，第一就係環球公共衛生，第二就係個人化嘅精準醫療。 我哋實驗室有5個具體目標。第一個係要睇疫苗猶疑，第二就係睇新病原體將會帶嚟嘅疫情，第三就係季節性嘅唔同疾病，第四睇返我哋藥物嘅安全同埋效力，最後一個就係泛基因組數據對於環球公共衛生嘅保護。醫衛大數據深色實驗室嘅合作伙伴包括倫敦衛生與熱帶醫學院，仲有倫敦大學學院，第三個呢就係悉尼大學，而第四個就係哈佛大學。我哋同我哋嘅合作伙伴希望可以帶動業界一齊去為香港保衞我哋嘅健康，亦都係去做好創科嘅工作。
So that was our founding managing director and also the former dean of medicine at the University of Hong Kong, Professor Gabriel Leung. So he would be a familiar face to many people who live in Hong Kong because he was at the front line of essentially using data analytics to explain and help us understand the pandemic situation, the COVID-19 pandemic situation. In fact, when the Inno Hong Kong grant was awarded, there was no COVID-19. COVID-19 didn't exist yet. And after we were awarded a grant, then suddenly the world is engulfed in this pandemic. And basically, our technology suddenly become front and center and really useful in tracking the spread of the COVID-19, the virus and the infection, initially primarily restricted to mainland China and suddenly across the globe. So we have made major contribution in our understanding of the epidemiology of infectious diseases through using big data and advanced AI technology. We have made use of real-life data from local hospital authority and other sources to help us understand the effect of vaccines and the side effect of vaccines through understanding large amount of real-life data. We've also collaborate with colleagues from mainland China and other government agency in understanding and really tracking the origin of the SARS-CoV-2 virus, its potential animal source, the zoonotic pathway that might lead to the current pandemic, and also what we may be able to do by understanding the sequencing data. So today I'm going to talk to you about my specific projects. So in my program, we look at the use of multi-omics. So basically different kind of large sequencing base or other molecular data. So these are really large scale data set. And how can we use it in understanding issues that are important in a global health setting and also at a personal healthcare setting. So in this case, I'll give you two examples. One example on how we use this for a global health pandemic situation, and the other on a personal health situation. So this is the case where we have been collaborating with our international partner, in this case the University of Sydney, in building up a system that allows us to collect and mine a lot of publicly available sequencing data that are related to the immune systems of COVID-19 patients. So one of the key features of COVID-19 is that once you have been, a person has been infected by the virus, they elicit different responses. Okay, some people have fairly mild COVID-19. Some people have very severe disease, and some of them actually are fatal. So we want to understand why. We want to understand the immune system that for different individuals and why different people respond differently to the virus. And we want to do that in a smart, data-driven way. What we have noticed is that actually we don't need to do a lot of experiment ourselves. A lot of this data has already been collected by scientists and medical researchers all around the world, in mainland China, in the USA, in Europe, in Australia, in all parts of the world. So wouldn't it be nice if we can just go and collect all the data and analyze them in a very efficient way? And that's where we develop this type of cloud-based, cloud-accelerated data analytical platform that allows us to really massively scale up our computational capacity and analyze all these data. So we have developed this cloud-based system using a commercial cloud provider, such that we can actually just scale up our analysis very quickly and reliably. So we have built something called a containerized computational pipeline using something called Docker image, so that we can process large amount of what we call single-cell transcriptomic data. Normally, analyzing one data set can take 20, 30 hours, a day worth of analysis. Now we can bring the analysis time down to 1.5 hours at the cost of around 4 Hong Kong dollars per data set. So basically, we want to do it cost effectively and quickly and in a scalable fashion. So this is a table that compare our technology in terms of our performance compared to other publicly available methodologies. So there are a few other platforms. In fact, the very first one in 2017 at the bottom, Falco, was also developed by myself quite a number of years ago. And now at D²4H, we are developing a platform that can do analysis at a very large scale at a much lower amount of time. So what is the application? So we put together this analysis where we combine all the data set that we have up till the recent month. And these include the PBMC, so the immune cells in blood from COVID-19 patients. So we have collected this data set that consists of almost 1,000 people all around the world. It consists of 5 million single cells, 5 million immune cells in COVID-19 patients. And we collected their clinical data and also their sequencing data. We perform analysis and we can put together a database. It's not just a database. I think the right way to think about it, it's a digital twin. What does it mean is that instead of doing study on a human patient or indeed an animal model, why don't we construct an in silico computational model that is driven by data so that we can perform analysis, simulation, and manipulation on this data-driven model so that we can understand potentially what might be underlying the diverse immune responses that we are seeing using this data set. So basically, we have built this database called COVIDscope, and the idea here is to create a digital twins for understanding COVID-19 immunology. So let's see, there should be a, oops, sorry. This should be a video, but doesn't matter, so I'm just going to tell you what's inside. So this is a database in which we can see that there are 5 million single cells. And when we go into this database, there are many different functionality where we can look at the different database. We can dissect the data based on different clinical characteristics of the patients. Patients who develop severe diseases, patients who develop mild conditions. We can look at other determining factors, such as age of the patients, the sex of the patients, or other comorbidities that might contribute to the diversity of immune response that we see. So these are some of the things that we can do with big data analysis that contribute to public health. So the next set of tools that we've developed, other than just looking at public health, we also develop AI-based method and big data methods to promote individualized health. One of the issues when we talk to doctors in Hong Kong in the last several months during the peak of the COVID-19 pandemic in Hong Kong is the surge of use of telemedicine. Basically the use of telemedicine for patients because either they can't go out because of the isolation order or because of other reasons, or maybe just because they feel it's more convenient, they're using telemedicine. So, but let's think about the clinical context. When we talk to doctors, what they experience is that, well, it's actually really not quite the same in terms of doing a telemedicine consultation and an in-person physical consultation, because in a physical examination, you can collect a lot more data that you can't really just do by talking to people. One such examination is auscultation, which is using a stethoscope to listen to the heart and lung and other biological sound. And this is something so critical that when you think about doctor, you would actually imagine a stethoscope, right? That's actually a symbol for a medical doctor. So the question is, can we use everyday technology, such as your mobile phone, to help to basically turn it into a smart virtual stethoscope? And that's basically what we have been doing. So we have developed a system called Ausculto. So Ausculto is a mobile enabled system that basically use your own phone, either that an iPhone, Android, doesn't matter, your own personal phone. And then we have developed some AI-based system to ensure that the quality of the sound is good enough for your a practical consultation, auscultation system. So in particular, we have developed a system for real-time recognition of the sound, real-time analysis, and effective denoising of the sound, so that you can in fact turn your mobile phone into a smart virtual stethoscope. Okay? Okay, so these are some sound. So as you can see, sorry, it's a bit loud. So essentially, these are sounds. What if you do not have Ausculto? If you're just turning on your phone to listen, to put it on your chest, there will be a lot of background and ambient noise. This is what will happen. So this is heart sound after denoising, okay? Essentially, it is exactly the same track. It is the same track after denoising. Sorry, this is another track. And this is after denoising. And this is lung. So essentially, we've built the system so this is something that's actually not particularly difficult, but why we think this is important is because we understand the clinical workflow, we understand what the doctors need. In fact, it was motivated by their needs before we built the system. So we've also built some kind of a verification system so that to ensure we know the identity of the patient, and also the patient know that their data are sent to the correct doctor. We have some kind of verification system that ensure that data are transferred to the right people between. So this is actually mimicking the doctor, Dr. Cat, and the patient, Mr. Fox, and in a real consultation, telemedicine consultation situation. So in addition to that, we have also been working with other healthcare providers, including nurses. So one of the issues that they have seen is managing pressure injury. So pressure injury is also called bed sore. These typically occur in elderly or people who are immobile. So they sleep in bed most of the time all day and not moving. So places like their back, their bottom, or the ankle area, where there is basically mostly skin, that's where you will see formation of wound, fairly big wound. And basically managing them can take a long time. And proper management, and importantly, proper assessment of these wounds are pretty important to ensure that these wounds can be healed properly. So we have been working with nurses to develop AI-based systems, so fast image recognition system, so that you can just take a phone. So even a less well-trained healthcare worker in elderly home or in a home care setting and just take a phone, look at the wound, and it will be able to perform assessment of what kind of stage it is in and what are the different features in a wound they have. So again, these are small tools that we've been developing that collectively we think are making a big impact to the healthcare in a community. So at the end, thank you very much for your attention, and this is D²4H, and more than happy to talk to anyone afterwards. Thank you.
Thank you very much, Dr. Ho, for your sharing. Thank you. Please be seated. Thank you so much.